Hello, my name is Temitope, and this is Grace Araoluwanimi. What brought me to Evercare? When I was 20 weeks pregnant, I did my antenatal here. When I was 20 weeks pregnant, during the anomaly scan, Dr. Chiroba, the sonographer, had found a cyst in her lungs in the thoracic region. And we informed my gynecologist, who now informed the thoracic surgeon, Dr. Harish, and the pediatric surgeon, Dr. Arua. We had a meeting and we discussed and had a plan to have birth. And we came to the hospital, and when they carried out an x-ray, they found the cyst. We had to meet with the team again, Dr. Arua, Dr. Harish, and including our pediatrician, Dr. Olugbemi. When I found out the cyst was there again, I felt really, really sad. I didn't want that. No one wants that for their child. But I'm a Christian and I thank God. I decided to trust God and trust that, He will guide the doctors to know what to do and to do the right thing. So during our discussions, they told me we would have to carry out a keyhole surgery, and the procedure they'll be doing is the Thoracoscopic upper left lobectomy. They also told me that this process could turn into an open surgery depending on the technicality of what they see when they start the surgery. We also had the option of doing the surgery abroad, but we decided to trust in the competency of the doctors and in their capability to carry out the surgery and come out with a good result. So come the day of the surgery, we arrive at the hospital the day before. It wasn't easy seeing my baby, being prepped and, going for a surgery. But I trusted God, I trusted the doctors. The day before, I'd met a couple of members of the team that come to visit us in the ward,
My name is Dr. Araoluwanimi. I'm a pediatric surgeon and minimal access surgeon at Evercare Hospital Lekki. Me and my colleagues met baby Araoluwa when she was still in her mother's womb.
My name is Dr. Olugbemi. I'm a cardiothoracic and vascular surgeon. We met this baby when the baby was still in the womb. Just to emphasize that prenatal diagnosis is very key in preparing the parents for how this child is going to be managed.
She was found to have a cyst in her lungs, in her left lungs precisely. So we had to explain to the mother the consequences and the possible treatment that she would need. So when she was born, we continued to follow her up and to monitor whether the cyst will disappear or continue to increase. So apparently the cyst continued to increase and we needed to do surgery at the age of 5 months. Before surgery, she was quite strong and she had not had any symptoms. But because of the increasing size of the cyst, there were increased risk of her developing infection and other symptoms.
This surgery, why is very key, is because it wasn't done open. So we did it thoracoscopically. That is, we put camera in the chest and with fine instruments, we were able to get that diseased part of the lung out. And the baby recovered in record time, and the family is very happy.
We were able to remove the upper lobe of the left lungs, and she made a smooth and very quick recovery. And she was discharged home for follow-up.
Her recovery has been amazing, to be honest. By the next day, she was playing, laughing. As you can see, she's active. This is about 2 weeks post-surgery. And she's doing great. She's doing amazing. I really, really want to thank God. Thank you to my husband. We were on this journey right from the beginning. Our parents, our siblings, they left everything. They were with us in the hospital through this process. Our friends, our family, our community, the support was huge and massive. I'd like to say a big thank you to the team that made this possible. I'd like to say a big thank you to Dr. Arua, the pediatric surgeon. I'd also like to say thank you to the thoracic surgeons, Dr. Harish and Dr. Olugbemi. I'd also like to say thank you to the pediatricians, Dr. Lakmil, Dr. Temtokwe Lawal, Dr. Gbemi, Dr. Bukumi, the nurses on the mother and child floor, the first floor. They were indeed amazing. I want to say thank you, for being dedicated to your craft and, for being on ground here to, provide the best care for my daughter.
So this procedure was done in conjunction with the cardiothoracic team because we're working very close to the heart and with very big blood vessels. So we had the best of teams, the best of the anesthetic team in place, and we had a very smooth procedure done. And at Evercare Hospital, we are well equipped to handle cases as complex as Araoluwa's case. And this is the first in Nigeria to be done using minimal access technique.
We have those facilities here. We have good staff, trained specialists to make such diagnoses and the equipment to make such diagnoses. And two, we also have the expertise and the skill, the equipment to do these surgeries here in Nigeria especially. So you don't have to travel out really. You can come to us and we can have it done and sorted out here. We believe in teamwork. The pediatric surgeon, the cardiothoracic surgeon, the nurses, the anesthetist, we all worked together to make sure that this patient did well. Now, even after the surgery, post-op care was also very important. The nurses did a fantastic job.
I also like to say to anyone who has such an issue, come to Evercare. They really provided an excellent service, to this situation. And I'm sure you'll be getting the best treatment as well.